Hi, I'm Dr. Sinha from Emory, and I'm presenting our poster here looking at a salvage regimen using several drugs: vinorelbine, paclitaxel, etoposide, cisplatin, and cytarabine, or the mnemonic for that is VTEPA, as a salvage regimen for patients who have relapsed refractory Hodgkin's lymphoma as well as diffuse large B-cell lymphoma. Now, the patient population, the data was collected retrospectively. We identified 74 patients. The majority of those were actually refractory to rice chemotherapy or some other form of salvage chemotherapy, and we found that despite being refractory to rice, we were able to salvage them with VTEPA, and about 33% of patients showed, 26% at least in the Hodgkin's lymphoma showed a complete response, and 9% in the diffuse large B-cell lymphoma showed a treatment response. We had 44% partial remissions in the Hodgkin's lymphoma group and 35 patients with in the diffuse large B-cell lymphoma. We also found that a significant population, particularly in the Hodgkin's lymphoma group, we were able to collect enough stem cells to go on and move them to a transplant. And as you can see, the majority of the patients in the Hodgkin's lymphoma as well as the diffuse large B-cell lymphoma went on to an autologous transplantation. However, there were 50% of patients that a transplant was not attempted. Now, the major toxicities are hematological. About 97% do experience grade 3 and 4 toxicity, but all of them were manageable, and the treatment-related mortality was 0% in Hodgkin's lymphoma and 9% in diffuse large B-cell lymphoma. We then went on to look at overall survival and PFS by disease category, and as you can see, mainly in the Hodgkin's lymphoma, we're able to salvage at least 50% of these patients who have been very heavily pre-treated and have not responded to other lines of salvage treatment. So really the major conclusion was that at least for Hodgkin's lymphoma, it is a good salvage regimen, and for diffuse large B-cell lymphoma, there is still the need for newer investigational novel agents. Thank you.